Okay, guys, we just going to start soon. We just waiting for everyone, and then we'll start straight away. Please, guys, if you want to comment or discuss with me, I would say the best way to do this is to join through the Facebook page. And our admins will send the link here to you right now. Thank you, everyone. Please, guys, also, if you can hear me on the Facebook page, please let me know. Thank you, guys. By the way, these days, we actually making our sessions somehow private. Not private, but the link will be sent to you privately. Because from now on, we will change the links from time to time. So everyone who wants to join us, they should actually text us and then we send them the link. Thank you very much, guys. Let me double check if you are on Facebook right now and we are live there so we can start the session. By the way, guys, today's session, I would say, is the most important session. Because if you understand the session very well and take it seriously, you will never ever struggle in the exam anymore. Dr. Alethea will have a session after me, and she may start at 8 o'clock. That's why the session will be only for 1 hour max. So I will start right now. Thank you, guys. Let me check on the Facebook first. Guys, can you see my screen, please? Let me just update here. Guys, please, if you can hear me and see my screen on Facebook, please let me know, guys. Thank you very much. Okay, guys, I can see you right now on the Facebook, and this is great then. Hi, Dr. Dilip, how are you going? Let me share the screen to you. Give me 1 second, please, guys. Okay, guys, I can see Dr. Dilip. Hi, Dr. Dilip, how are you going? Hi, Dr. Shashank. Hi, Dr. Sahifa. Hi, Dr. Koshiken, Dr. Sampreet, Dr. Clover, Dr. Nadzda. Hi, Dr. Sahifa. Thank you very much, Dr. Nadzda, letting me know. Hi, Dr. Fatima, Dr. Mamit, Dr. Amulia, and then Dr. Valija, and also Dr. Didi Damshan, every one of you guys. Okay. Today's session is actually a very important session. Hi, Dr. Harpreet, how are you going? I'm very excited to Dr. Leah for this session too, because I would say the session is the most important session for the candidates who couldn't pass the exam and the candidates they prepare actually for the exam for the first time or maybe the second time. Let me share the screen. Guys, I believe you see my PowerPoint right now. So the session today about the secrets of ADC exam. Why I'm saying the secrets? Because actually not everyone knows about this. If I ask you a question in the beginning, what do you think why some people can pass the exam and some people cannot pass the exam? What could be the reason behind this? Please, admin, don't mute me because I don't see if I'm mute or not. So guys, if I ask you a question right now, what do you think actually is the reason or what are the reason behind some candidates to pass the exam and some candidates will not be able to pass the exam? Let me check your answer here. Today I'm gonna make it easy for you. The answer is, I'm just going through all your answers right now. The skills of critical thinking and knowledge. I agree in this. Misunderstanding the concepts. I agree in this. Stress and time management. Yes, guys, you're right. Dr. Nitika mentioned I lacked proper guidance. That's true as well, Dr. Nikita. Lack of understanding of concept. That's true. Luck is very important. Dr. Clover mentioned no idea. You will know, Dr. Clover. Stress once you start doing the first question of ADC, Dr. Ryan will discuss about all of this right now. Overthinking why selection options. Thank you guys for this. You know what? Write down all these points because this is exactly what we got discussed, but in details. People thinking to pass ADC exams only one thing. Right? Okay, let's talk about them right now, one by one. Anyway, guys, let me check if you have more points. I'm not sure where I went wrong. Dr. Damish, we will discuss about this. Not taking enough time to prepare. Guys, am I audible? Dr. Walija mentioned I'm not audible. You see? Guys, am I audible? Yes, that's good, Dr. Ash. Thank you very much, Dr. Ashnit and Dr. Amolia Lemino. Now, I will read back again what you mentioned, guys. By the way, everyone has mentioned something here. I believe they have been in exam before. When they mention lack of clinical judgment, less time is spent on the right way of learning, stress once start doing first question of ADC, stress, overthinking, all these candidates, all the champions, I believe they've been exam before and they have experienced this by themselves. Dr. Shiva, I hope you can hear me because everyone say I'm audible. So maybe it's an internet connection and you really need to work it out. I believe so from your side. Now, as I always say, success is not a stroke of luck. It's a journey, sometimes tough, but never impossible. You need to work hard and you need to work smart. Enjoy the process and remember, success is real when you refuse to give up. So guys, everyone who has done the exam before, everyone going to do the exam, please don't give up. Now, this is a question, guys, most of you ask. Am I right? Guys, am I right about this? This is a question most of you ask. I have taken the exam multiple times, and each time I feel confident that I am choosing the right answers, but I still fail. Why is this happening? If you learn the reason behind this, you will pass the exam. I will take you slowly through very short steps And then at the end, if you did the exam before, you will understand why. There must be one reason has happened that made you to not pass the exam. Generally, I'm talking now generally. SPQs, as you see right now, SPQ stands for scenario-based questions. To what? To test the candidate's ability to apply dental knowledge to practical clinical situation. That's number one. So number one, the most important thing is to apply your dental knowledge to practical clinical situation. Some of you has mentioned this. Someone of you said, yes, we need to understand about practical clinical situation, not just the theory. Critical thinking, very important. Critical thinking means you are in a situation like you are at your home right now. And then you want to cook some food. You have only half an hour left and then you go to job. You have different options. One is to go to the next or the nearest restaurant, buy yourself a drive-in, and then get whatever ready. The other one is you may order an Uber, but the restaurant is far, and then Uber may take about 25 minutes to 35 minutes. You only have 30 minutes to eat. Or you have some eggs and some cheese in the fridge, and then you don't like them, you hate them, but this is the quickest. You may eat it, and then you go to work. You have different options. All of them can be valid. But the only critical thinking, your decision right now is going to be the difference to choose the right answer. Out of my example, guys, which one are you going to choose? Eggs and cheese from the fridge, the one you hate, the one you don't like, or Uber, they may be late. It's up to luck, maybe 25 minutes, maybe 35 minutes. You only have 30 minutes max to eat. Or the next door shop, that is about 20 minutes drive, but you still need to pay, and then you need to select the food. Which one? Believe me, exam will be like this. All the options like crazy. Am I right, guys? People in the exam before, am I right? Now, apply this dental knowledge. How to get the right way? The right way about this, which is decision-making skills, it's based on what we face here in Australian based. What we do in this study here in Australia. That's why I have seen our champions who passed the exam in in March and September. And always they've been the highest and the leaders, because when I speak to them, I found them, they really has absorbed the right information, knowledge, and that's why they made our champions to be the leaders. Now, doctor, I wrote down or I write down everything. I have the critical thinking, but still I cannot pass the exam. So now, critical thinking, decision making, what I keep guys explaining to you, that also comes from the clinical scenarios, the mock we do, and also the evidence-based solutions, which is our guidelines here in Australia, including therapeutic guidelines, Australian Dental Association articles, and other practical things. Practical application and ethical diagnostic and management principles. Again, this is what we actually teach you in the beginning. Now, if this is enough to make you pass the exam, the answer is, what do you think, guys? If you have the best critical thinking, decision-making skills, if you have read day and night, ADA guidelines, if you know therapeutic guidelines by heart, will there be enough to pass the exam? The answer is no. Really? Yes, really. Why? You will know no. You will know now why it's no. ADC exam is a system. Exactly like cooking a cake. Consider critical thinking, decision making, clinical scenarios interpretation, and then evidence-based solutions, all the stuff. Consider all the stuff. It's just like the temperature of your oven. Just the temperature of your oven. All the stuff. You still need to get the proper recipe. You still need to get the how many eggs you're going to use, the flour, sugar, milk, butter. So now, as if by learning this stuff only, it means you just set up the proper temperature. Guys, can you, if I give you stove only or oven only, will be able to cook a cake? Or should have a proper recipe? And the recipe, do you think only in one thing or multiple things? Thank you, Dr. Leo. The answer is no, you cannot. Like calculation, are you calculating a math problem? If you calculate a math problem and then you miss one number or one step in the calculation, everything going to be wrong. That's why critical thinking, decision making, very important. Evidence-based solutions, very important. Ethical diagnostic and the management principle, very important, but not the only thing. Okay, doctor, I have read everything. I read TG, I read Odil, I read this. Yes, you only did this step only. There are more beyond this. One mistake equal to different results. And that's why you may pass one cluster or two clusters, but not the second, not the third and the fourth. Why? Because study TG, to study TG and ADA guidelines, it will make you to only fulfill this slide, only this slide. How to achieve that? Believe me, not only study. Not only study. It's a package. One number missing calculation, the whole calculation will be wrong. Let's now see what's involved in this calculation. That's something very weird. Doctor, we're talking about dentistry here. We're talking about ADC exam. So why you ask this question? Why you ask, who are you? Why do you ask, who are you? Is it really a matter? Yes, it's a matter. Guys, by the way, can you see my screen or not? Am I sharing my screen or not, guys? Yes, okay. So now, the question here is, who are you? Is it really a matter? Yes. Why it's a matter? Because later on, we're going to discuss about two different stages. The study stage and just before and in the exam room stage. You know what? This is from my own experience since the last 16 years teaching for ADC. I have seen three types of candidates. You can choose which one you are. A candidate who is smart, believe me, guys, very smart. They know all the information in and out. When I ask them the questions before the exam time in the preparation stage, in this stage, in the study stage or preparation stage, when I ask them questions, when I test their knowledge, they are the best ever. And I feel proud of them. They study hard. They're really smart. You know when exactly they do this? Only in this part. Here. This candidate, the first type I'm talking about, they're very smart, they study hard, they know the knowledge in and out, and I always feel proud of them. Only in this stage. You know, later on, once they come before, just before the exam, I start to find that they knowledge start to be wrong. That's the first type. I don't know, guys, who is this? Which one of you is this? Very smart. They know everything in and out during preparation time. When they answer the question, they have the best concepts ever. But just before the exam, you will find them. I found them, they really got confused. These people, they have trust issue in themselves, trust issues. They don't trust themselves that much. And that's why once they get closer to the exam, they mess up with everything. This is the first people I have seen. This is the first type. Second type, they don't study in the beginning. They only study here. They only study just before the exam. And then it can be very risky because it's not predictable. They are very busy. They don't try to find solutions, and they only study just before the exam. The third type, and this is what I'm looking for. Should be every one of you. And we're going to discuss this in details. What is the third type? They really study very good from the beginning. They can control their stress. They have a strong, guys, listen to this. They have a strong personality, like a leader, because they trust themselves. They understand the system. They study very well in the beginning, and then they tick every single success factor from whatever we're going to discuss right now. These people, they do the best during the study stage, and they do their best just before the exam, and they do their best in the examination room. Why? Because the first type of the people, once you go in the examination room, they feel confused very much, and they start to mess up with everything. Guys, am I clear about the three types right now? You can tell who are you at this stage. If you are the first type, the second type, or the third type. Because once you know who you are, you need to fix this part in you to pass the exam. Again, exam, not only study. Exam, not only study. To pass the exam, not just study, not just study materials. So you need to understand who are you. You must have a strong personality. Believe in yourself. It's a change of lifestyle. You must change your lifestyle as a person. If you think about yourself, that's you're not confident about what you're doing, please be confident. If you don't study from the beginning, study, because the first type of the candidates who really did very well during the preparation stage, and I know lots of them. These champions, they only lack in the second point, not in the first point. But the other people, which is the second type, which is actually doing good just before the exam, it's risky because sometimes they don't have enough information as point one, and then they go into exam and then they're still confused. But the third one, or the third type, they actually mix both together, one and two. Now, study stage. Let's discuss about the first point, study stage. Guys, I believe that's maybe the first time you have heard about this point, or maybe it's the first time you think about it that way. In a study stage, what's important? Language barriers. Really? Is it real language barrier something important? Yes. When I'm saying language barriers, you shouldn't be an Australian native. You shouldn't have 100% of English language proficiency. You don't need this. But what I mean about language barriers, ADC on Australia, we use a language somehow, it's very neutral type of language. When you look at it, you feel very confused. What does it mean exactly here? Seems like the language is confusing. Guys, am I right about this? Have you felt the same in the exam? Have you felt that the language is very confusing, not clear enough? And that's why you need to prepare yourself from now about language. How we do this? Listen, from now on, listen to Australian-based EDA podcasts, for example. Because the language that they use here in Australia, look, if you work in dental clinic, and that's what I found. Look, guys, I meet you in academy. I meet you when you do on-site mock inside the academy. I meet you when you come and to discuss with me about your circumstances in the academy. Definitely, I see you in the sessions. I see you personally. I found the people that work in clinics, they have a little bit higher chance than the other people. They don't work in clinics. Why? Because they don't have that much language barrier. It became less, but again, I'm not spotting only on one point. If you think I'm saying if you have a good language, you will pass the exam, that's not right. If you think that I'm saying to study and to have critical thinking and Australian-based or evidence-based information, that's going to make you pass the exam only. I'm telling you that's not right. As I mentioned before, it's a package, not only one thing. That's why you don't fail the whole exam mostly. You only fail one cluster. Why? Because in this cluster, one of these has happened to you. What else after language barriers? During preparation or during study stage, you must build up your study plan. Trust yourself. The candidate, they don't trust themselves during the preparation or just before the exam, they spoil what they made from good job. They spoil it. Exactly like cake. Let's take a cake an example here in this session. Guys, what temperature, if you, I believe most of you, the women here, the lady dentists, they understand when they cook cake on the temperature. How much temperature, guys, for baking? If you bake cake, how much temperature you want? For me, what I know is about 180, 185 Celsius, like about. Don't go above 200. I don't know. That is what I know. Because I like to be like very slow. 180? Good, Dr. Nikita. You are a good cook. Right? Yes, I agree in this. 180. Yes, I agree. 175, 180. Now, imagine you did the best preparation ever. As exactly, you made the best recipe ever. The milk is correct, butter is correct, flour is correct, the proportion between all of this, perfect. But you know what? Instead you use 180, used only 130, or you 300. That's exactly happened with lots of candidates. They do preparation very well, but once they get closer to the exam time, they spoil everything or in examination room. That's what we need to work it out. That's why during the preparation time, you need to trust yourself. You must have a proper realistic timelines. You must have a proper plan during the preparation. You must be consistent. Why this? Because if you don't trust yourself, you will not study. What does make me doing sessions every day? What does make me feel happy when I come every day to help you? From where this coming from? One, from my confidence. I trust myself. I know who I am. I know my experience. I have seen me in the situation many times. That made me to not stop at any day during my life to do my work and help you. Why? Because I enjoy what I'm doing. And here is the point. During preparation time, you must trust yourself. Guys, you are in the first stage, the study time. Because if you don't trust yourself, you know what's going to happen? You will feel scared. When you feel scared, the fear will stop you to study and to study the right thing. And then you're going to have 1 day pause, 2 days pause, 3 days pause, whole week study nothing. You wasted, gone. Why? Because you don't trust yourself. You must stay consistent during, guys, we are in this point, by the way. We are in the point which is study stage. Not yet, on just before, on the exam room. During study stage, you must stay consistent. You must motivate yourself. I would say 3 to 4 hours strong study with concentration will be enough. Write study materials. Last time when we spoke and when we got our successful champions, to share the experience with you, I asked one of them. She was Dr. S. She passed the exam and then she spoke to me personally one time and she asked me, Dr. Adam, do you think the study materials you provide us is enough or we should read more? I told her I'm been in this process in 16 years. And I follow up what's happening in Australia on, I would say, daily basis or weekly basis, whatever updates happen. So I trust this curriculum, and I believe that's the best, making a balance between everything, because dentistry is a vast type of science. You cannot, at any circumstances, expect, however, I expect up to maybe 90% of the topics or even more, but you cannot expect what changes can happen in 100% changes. Anyway, saying this, guys, whatever we give you from study materials, this is the things you must finish first. and will be enough, because after she passed the exam, I asked her, do you remember when you asked me about the study materials? What's your answer right now? She said, yes, was really very enough. And by the way, she said this even in the sharing experience session. Now, read what we give you. Don't confuse yourself, because I see people, they confuse themselves. They go and read from here and there from different topics, different study materials, and finally they get lost. So please, guys, you don't need to think about that much about what sort of study materials, but you must read the only required and important study materials. The second point, just before in the exam room. Do you know what? If 10 people, 10 people couldn't pass the exam, tell you something very important here. 3 of them couldn't pass because the first point, which is the study stage, because they didn't study. 7 of them, 7, they couldn't pass because this point, just before the exam or in the exam room. Guys, do you agree in this? Out of 10 people, 3 people don't study, 7 they study, and they study very well, but they mess up with the exam in the second point, which is just before and in the examination room. Why this happened? Personally, I spoke to lots of you before the exam. In Academy, I select people randomly. And then I speak to them before the exam. How you go? Some of them, they stay strong. They confident about what they're doing. Let's guys discuss before the exam. We are now in before the exam, this point. How do you go? I did very well, doctor. I read TG, I read Bidobites, I read cakes, diamonds. I did all the mocks we discussed. Sometimes I score good, sometimes no. I attended all the session, write down the notes. I'm taking some days off from work. I'm somehow stressed. But still doing good. I love this type of champions. Because believe me, this type of champions, the type who has passed until this stage. We still have another stage here. Okay. Another type of champions. You know what? I really respect them very much, because I know they're still doing their best. But they cannot control and change their personalities. And that's why I keep talking to them and telling them, I keep support them and try to give them some hints to control this. Some of them, they are able to do it, some not. Before the exam, I ask them, what you do? I'm very scared. I feel confused. I cannot sleep. I cannot eat. I feel I'm lost. No, don't be that person. Because actually, you've been doing good. You are one of the 7 people. They have already started very well. Please don't spoil the cake. Don't spoil the cake. You did the best ever cake. Instead, you make it sweet by adding sugar. You just now start to add salt. Stop. You're doing good. But they cannot. Some of them, they may have some circumstances. They had to travel overseas for some reason. They may get one of the family sick. They may get sick by themselves. It can be different reason, but finally, just before the exam, they're going to spoil the cake. They have spent 3 to 6 months preparing this cake. Guys, I hope I'm clear in this point. Am I guys clear about in this point so far, which is just before the exam? And by the way, I give you 10 people or candidates example. 3 of them, the issue in the first stage. 7 of them in the second stage, this stage. Just before, you can consider 3 people as well. So now 6 people, 3 of them in stage 1, 3 of them just before. 4 people couldn't pass. And by the way, guys, this percentage based on my experience and statistics we do in the academy. 4 of them in exam room. What's happening in exam room? Now, the week and days before the exam, ask yourself, because that's one of the most serious time. Did you what? Did you sleep well? Did you eat well? Did you trust yourself? Did you have fun? Did you rest? Have you been motivated? Did you revise, but with love and enjoyment? If any one of this was no, did you control stress? If any one of it, have you been consistent about what you're doing? If any one of this was no, means you did something wrong just before the exam. Now, during the examination time, once you are in the exam room, scenario versus the questions and options. Here is a big game. 4 out of 10 people, 4 out of 10 people, they fail because that stage. They really study very well. They really control their stress very well. Before the exam time, they studied well. They eat well, they sleep well, they have everything fine. But during the examination, inside the exam room, they changed. Why? Misleading correct answers. For them, they have seen all options seem right. And they may choose the partially correct option. Why this? It can be one of this reason. They may have some issue with Australian guidelines. Again, they may be at some stage during the preparation, they missed this point. English, as I mentioned the first slide, one of the first slides, English barriers. When they read the scenario, they couldn't understand the scenario in the right way. Exactly as if I'm telling you, if I ask you, who are you? Guys, if I ask you this question right now, who are you? What will be your answer? You will find the answer will be different from person to person. Guys, who are you? Before you answer, I tell you what you're gonna say. One of you gonna say, my name is this. One of you going to say, I am a dentist. One of you gonna say, I'm an ADC fighter or aspirant. Am I right, guys, about this? So the word, believe me, ADC questions will be like this way. Who are you? And then you get confused. Which one should I choose all of this? Because I can be any one of these. So again, Australian guidelines and English barrier and the context as well, they are very important to choose the right answer. Sometimes you need to choose, sometimes can they choose the unsafe and unethical choices first. In Australia, if you are confused, you need actually to think like safe dentist. By the way, guys, Dr. Alifia. Hi, Dr. Alifia, how are you going? If you are there, because I know you are there and you have your session now. Hi, Dr. Alifia, how are you going?
I'm good. How are you? Good evening.
Let me just because yes, now I can hear you, Dr. Alifia, if you don't.
Amazing. Good evening, Dr. Adam. I'm good. How are you? Good evening.
Good, Dr. Alifia, how are you going? No, good. Just because yes, now I can hear you, Dr. Alifia, if you don't.
Amazing. Good evening, Dr. Adam.
Good, Dr. Alifia. Sorry, I may take another 5. I know there is some echo. Let me do something here.
Good evening.
Yes, I can hear, but there is some echo here. Okay, Dr. Alifia, sorry because there is some echo here. So what I'm trying to do is I'm trying to, yeah, I think it's from now. I think it will not be any more echo. Dr. Alifia, can you hear me?
Yes, Dr. Adam.
Yeah, that's fine. No more echo anymore right now, which is good. So I may take another 10 minutes max, and that's it, Dr. Alifia. Okay, sorry for this.
That's okay. Thank you.
Thank you, Dr. Alifia. Okay, guys, back again. One of the tricks really you need to understand is to think as a safe OZ dentist. Time management is very important, guys. That's why Alpha Genius will help you the most. You must stay calm across the 2 days. And definitely final revision in the course will be, that's why we give you different revisions, multiple revisions. Here is the most important slide ever. One for the 4 people, because I divide you guys. What I did right now, I mentioned 10 people. 3 of them, they have issue during the study stage. 4 of them, just they spoil everything just before the weeks and days just before the exam. And then 4 of them, they spoil the things during the exam or in the exam room. And if you are a person out of the last 4, if you think yourself, You did very well study, very good study. And before the exam, you managed your time. Before the exam, you've been very consistent and you control stress. Now, this slide is for you because I believe that's why you couldn't pass the exam. One, during the examination, your problem not study because you read it very well. But your problem is overthinking in the question. You keep overthinking instead of trusting first instinct. Guys, who's this person here? Who's the person who did very good study? They control their preparation just few weeks and few days before the exam. But the problem is they kept changing their answers. And believe me, guys, this is the 70% to 80% of the 4 people they fail. Like 3 out of 4 in the exam, they fail because of this. And I believe most of the people pass the exam, they pass because they don't have this one. Missing key clinical clues in the STEAM, in the scenario. Yes, I would say 1 to 2 out of 4, they may be involved in this one too. When they read, they become under pressure, they became under stress, they couldn't sleep well. I'm telling you guys, this is the best example ever. This is the best example. You know, I am the one who's doing my own, I am the one who was doing my own mock exam. Imagine this. Sometimes I answer the mock exam that I made it by myself wrong. Imagine. Do you know why? Because this one. Because I became in rush, for example. Because I see only 5 minutes left and I need to answer 10, 15 questions. I don't read the scenario properly. I don't read the questions completely. I don't read the options. And then I miss clinical clue in the scenario I made by myself. Imagine. And you didn't do ADC questions by yourself. So what I'm trying to say here is, during the exam, you must have clear mind. Doctor, I have clear mind, but I couldn't pass the exam. Okay, could be the second option. Misinterpretation. Maybe something in the study stage. Maybe before the exam. That's why I said it's a package. If you miss one of these during any of this stage I talk about it right now, I'm telling you, you're really gonna be in trouble. But if you do all of this right, you're gonna get the highest score ever. What else? Misinterpreting the scenario due to lack of real world practice and language barrier. Again, language barrier. Again, misinterpretation. You read, you got the missing key, you got the keywords, but you interpret it wrong. And the options, you interpret the option wrong. That could be one thing. Sometimes you choose based on memory. You say, you know what? I have seen similar questions, and the answer is this. No, read the question again, because one word can change the whole scenario. I hope this slide is clear to you. Time management, rushing at the end, very bad. I told you about it. This is me. When I do the mock exam, when I explain to you too much in the beginning of the mock, and then I come at the last maybe few questions, and then I need to run quickly to rush in them because there is allocated time. In this case, I don't read them properly, and then I start maybe answer one question out of all this question. Why did I answer this question wrong? Only because this part. You read fast, as you see right now, and skipping small details. Sometimes under pressure, you fail to apply the right approach, safe, ethical, and reasoned. I just only give you some solutions here for yourself, how to avoid this. We have the video technique. It will help a lot. But again, alone will not be enough. It's a package. Eliminate wrong choices. Pick best from similar options. You must look at the keywords. Keywords like what is the most appropriate management, for example. Remove unsafe, unethical, or clearly incorrect options. Narrow down to do best options. You will find all the options are similar. Choose the most appropriate, the most safest, the most affordable, and still, yeah, and what the patient asking for to make the patient happy as long as it's applicable. And that's all should be based on Australian guidelines. Guys, I would say thank you. You really need to trust yourself. I will be next to you. I will be around you. By myself, your success is my enjoyment. That's why I will never ever leave you behind. Everyone asks for my help. I never leave them behind. I'm always next to you because I want to see every one of you pass the exam. As I always say, you're not a candidate for me or for the academy. We consider you all the time family members, as brothers and sisters, as patients. I consider my patients family members. I hope, guys, this session has helped most of you today. We're going to do more sessions. And by the way, mock exam supposed to be at this week. I still haven't announced for it. And by the way, too, you remember, guys, the new TG? I'm going right now to make a poll for the new TG because we have 8 points. I think 6 to 8 points or topics we need to discuss about TG. So you guys choose which one, okay? Thank you, guys. The course, by the way, I think Wednesday will be the orientation session for the course. And the course will start this Monday. The actual course, the main stage of the course, with lots of changes going to happen, new courses, new stuff, because I always, every time I change in the course, adding new things to help the candidates, including new TG. That will be starting next Monday. And the orientation session, I believe, will be in this Wednesday. Thank you very much, guys. Have a great night, every one of you. I was very happy to have all of you here. Stay, Dr. Alefia may talk about something important because part 1 and part 2 are the same right now. Mostly the same. Part 1, people getting questions, by the way, from part 2 these days. Guys, by the way, part 1 candidates get question from part 2, even the previous exam. Part 1 question, got part 1 candidates got questions from part 2. Thank you very much, guys. Thank you, Dr. Srisha, Dr. Arshinor, Dr. Naveen, Dr. Clover. Thank you very much, Dr. Fatima, saying that was wonderful session. Thank you very much. Thank you, Dr. Sibia. Thank you, Dr. Martina. Thank you very much, Dr. Martina. That's a great job helping all the candidates here. I love you guys. That's great job, Dr. Martina. Okay, Dr. Alethia, are you ready right now? Thank you, Dr. Jilan, very much. Thank you, Dr. Teresa. Thank you, Dr. Vishali. Dr. Alethia, sorry, Dr. Alethia, I'm not quite sure if I can hear you or not.
Yes, I'm here, Dr. Adam.
Okay. Okay, guys, as I mentioned before, Dr. Alethia, what are we going to discuss today? It's about technical?
Yes, I'm just going to give a little bit of overview about ADC Part 2 exam because everyone who's passed Part 1 recently, it'll be great help. And obviously, even the ones who are from Part 1 right now, it would be a great help for them in the future as well. And a little bit more into technical.
Yeah, because they get questions about amalgam and the composites, preparation, cavities, and all the stuff in Part 1. That's why when you discuss this point, they should listen to you as well.
Yeah, right.
That's what I understand. Okay. Okay, guys, I will be here around. I will be listening to Dr. Alethia. I will be helping her from time to time. Okay. Would you mind, Dr. Alethia, do this?
Yes, Dr. Adam.
I can
Definitely.
do it. Okay, thank you, Dr. Alethia. Okay, guys, I'm here around. Thank you, guys. All the best to you, Dr. Alethia. All the best for all champions, guys. Thank you.
Thank you, everyone. Alrighty. Dr. Leah, you've raised your hand. Okay. All right, everyone. So good evening, and thank you for staying back for the session. And everyone who's joined right now, welcome into the session as well. So this session mainly giving all our candidates who's passed the Part 1 exam recently a little bit of overview and guidance about what this Part 2 examination is going to be like, right? So I'm going to run through a little bit about what the actual exam is and then give you a little bit more insight on the technical part of the exam, okay? I do not want to bombard you with a lot of stuff today because I know already it's a lot of information for you all. You'll have just cleared the exam. You'll had a home setup session yesterday with me, which already you'll are probably processing. And then I do not want to give you a lot of information, which is going to confuse you because we're going to have a lot of these sessions in the next week as well, where we can go more and more in detail. Okay. So I'll try to keep it short. I'll try to keep it to the point and a little bit simple so that you all don't get confused at this stage. Okay. So, Dr. Adam, let me share my screen.
No problem, doctor. Give me 1 second, please.
I can actually do that. That's fine. You won't
Okay,
have to
great.
do it. Okay, I think you all can see my screen now. Yes, and you all can
Yes,
see
if
the.
I can see.
You can see the presentation as well. That's amazing. Okay, so let's start. Basically, what is this ADC practical examination all about? What is all this hype about? Is it really a hard exam? What is it going to look like, right? And this question, I know, Dr. Adam, you also asked yesterday that is it really hard exam, right? So let me tell you first, and let me reassure you that this exam is, I wouldn't say it's a hard exam. I can say probably that if you work hard for this exam, it's a very doable and it's a very achievable exam. And it's pretty straightforward. Like, if you go and perform exactly what ADC wants you to do without getting confused, without, doing extra than what ADC wants you to do, you will definitely pass this exam. Okay. And you'll all have been in Dr. Adams' part one session right now, and how he was explaining to you all about certain things which we as a person might get stressed, or we might not do those right things before the exam, or we might not end up doing those things on the day of the exam, right? Those are the only factors which will affect you not passing this exam. Okay. So if you manage your stress well, if you manage your time well, which is the most important thing in the ADC practical examination, it's all about managing your time. It's about managing your stress, and it's about how you're going to perform exactly when you're put into that scenario, which is of high pressure scenario or a high pressure environment, right? Because that's what you would do in everyday clinical practice. Okay. In a clinic, I don't know how your clinics are currently, where you all are working. It must be overseas, it might be in Australia, but in most of the clinics, they're very fast paced. You're seeing like at least 10, 12 patients in a day. It's all back to back. Every patient has coming with its own stress, and every procedure also comes with its own stress, with its own technique. And obviously, that pressure eventually builds up. And that's what they are assessing you on in your ADC Part 2 journey, right? Or in your ADC practical examination. Because they want a dentist, or they want somebody that who will um, who will be able to manage this pressure, and who will be able to manage this time, how you would ideally do it in your clinic as well. Okay. So I want you all to start focusing from now, that how you all are going to start working on yourself, because it's not only working on the technical part of this exam or the communication part of this exam, but it's all about your stress management and how you're going to change as a personality, and how you're going to make yourself more of a calmer, more of a stronger person, and more of a resilient person in this exam. Okay, because ADC is going to test your patience. Obviously, you'll have seen this in your part one as well. ADC examination does test your patience, and we see that day in and day out in the academy, right? We see so many different people, so many people coming from different backgrounds. They're coming from all over the world. They come with their own baggages, their own stresses, right? So we've seen a lot of them. Okay, and we realize the more and more we see people, that how many different stresses can be hindering in this exam, and that's where you'll have to eliminate all these stresses and focus on your exam. Okay, and that's why I say it's a very, very doable exam. It's just how you're going to manage your stress, your time management, and that's all obviously what we teach. It's not only about we teach technical in the academy, right? We teach overall, like how you're going to manage that stress, or how you're going to anyone can teach you how to do an amalgam, but how are we going to manage to do that amalgam in that much particular time? And even if you end up messing it up in that particular time, how are we going to fix it? Okay, so that's about the right guidance and how you're going to learn how to fix it in that much particular time. Okay, because obviously things are not going to go as per plan, same like in the clinic, but you need to know how to fix it. Okay, and that's what we normally would teach, or that's what I normally also would tell the students. Okay, or tell our candidates as well. Okay, so coming back to your question, is ADC practical examination really hard and achievable? It is not hard. It is definitely, definitely achievable. It's about what guidance and how much you're going to practice and all of these things as well. Okay. Obviously, your support system, you have to have a very good support system in this journey. Your family is going to be your greatest support system, obviously. We, as an academy as well, eventually we become your family because you'll see us day in and day out. We work as much as hard as we would work for any of our family members. Like, I have so many of my closest friends who've done this examination. I work the same way towards them as I would work towards any candidate in the academy, right? Because eventually you all are our family as well. Okay. So you need to have a good support system. Find your family, find your friends who are giving this examination, find good peers in this journey, and always study with study partners. When you study with study partners, this journey becomes easier because trust me, in this journey, people might not understand you, right? Like your partners might not understand if they're not a dentist, or even if they're dentists and if they're not going through an ADC examination, they might not understand you, like what you are going through, because there are many challenges of ADC which an outsider or a third person cannot understand. I can clearly understand because I've gone through this exam myself, right? Like Dr. Bido can clearly understand. Some of your friends or family members who've done the exam can clearly understand, but some people who are not in touch with ADC might not understand. So you really need to get your circle, your close circle, and be genuine, be true to that close circle, because this examination is not a competition amongst each other. Okay, it's a competition within your own self, and every day you're going to become a better version in the ADC dental part. You all must be amazing dentists. I'm sure that you all are all specialists. Some of them are like postgrads, and you all must have like a lot of knowledge. Some of them might be like 20 years experience in their own respective countries, right? So you all just have to find your support system and obviously the right tutors. And I'm very glad that you all are here. You all are selecting the right people, and that's why you all are in the session, that you all are selecting a right support system. Okay. Now, what is ADC Part 2 exam all about? Like, if you look at this picture, looks like chaos, right? There's somebody running in the background there. Some students are like focusing and practicing something. So this is basically your ADC Part 2 examination hall, right? Or where you're going to go and sit for your ADC Part 2 examination. This is a picture taken from ADC itself. Okay. So it's going to be somewhat like that. All right. So you need to start simulating this environment within at home as well, that you're going to practice in this environment and all of these things right from the small stuff. Okay. Now, what is it about ADC practical examination? Basically, you have 2 days. Okay. I'm going to divide those 2 days for you all. One day, or day one, you can call it. It could be either day one or day two. It could be swapped between. Okay. So we have a technical day. In technical day, basically, you will have 6 hours. So suppose if you're starting at 9 o'clock in the morning, the exam starts at 9. You will have 9 to 12, like 3 hours. Then you'll have like a 1 hour lunch break, and then you'll have another 3 hours after lunch break, right? So I'm obviously 9, I'm just giving you a time that ADC will give you all the times and stuff, like maybe 8:30, not 9. But it's going to be 3 hours, and then you'll have a lunch break, and then you have 3 hours again. Okay. So in these 6 hours, basically you have to end up doing 6 tasks. All right. So I'm not saying that one task, 1 hour. You can take how much ever time you want for one particular task. So if you end up doing one task in 20 minutes, or you could do one task in 3 hours, doesn't matter. As long as you finish all your 6 tasks within those 6 hours. All right. So that consists of your technical day. In your technical day, these 6 tasks which I'm talking about, you will have either one which is preparation of a cavity, like a cavity prep. So they'll give you a tooth, like I already spoke to you all in the home setup yesterday, that you have a caries tooth. Caries tooth meaning a tooth which already has caries in it. And then you're going to just simulate it in a way that you're removing the caries from it and you're preparing a cavity. Okay. So that's one task. That is preparation or a cavity preparation. All right. Your second task will be like a crown cutting. So they will give you a tooth where you have to cut a crown on it. And which crown you're cutting? You're cutting a crown for a PFM, which is for porcelain fused metal. The third task you'll have is doing an endo-access cavity. All right. So basically, you're doing an access cavity in a tooth, which is an endo tooth. I showed you all yesterday as well in the home setup session that there are some teeth which are called as the endo teeth, and you're basically going to do an access opening into that endo tooth. All right. So these three tasks basically become a part of your preparation cluster, because in all of these you're basically cutting the tooth, right? In cavity prep also you're cutting the tooth, in PFM also you're cutting the tooth, and in endo also you're cutting the tooth or you're drilling in the tooth. So all these three tasks become a part of your preparation cluster. So basically you're preparing the tooth. Okay. Then you have the other three tasks which come under your restorative cluster. Okay. So restorative cluster means that you are doing some form of a restoration on it. Okay. Now that restoration could be either making a provisional crown. So you will have one of the tasks will be making a provisional crown on the same tooth which you have cut for a PFM. The second task will be your amalgam restoration, that they will give you a cavity already made, and then you're going to put amalgam in it and you're going to carve the amalgam restoration. Okay. And your third task will be a composite restoration. So basically you're going to they'll give you a cavity and then you'll have to do a composite in that cavity. Okay. So if we divide our technical day into two halves, we have a restorative cluster, which I just spoke about, in which you have amalgam, you have composite, and you have to make a provisional crown. And then you have another cluster, which is called as the preparatory cluster. In that cluster, you will cut an endo tooth, like for an endo access cavity. You will make a cavity, or it'll be a cavity prep task on a tooth which already has caries in it. Okay. And the third one you will do is a PFM, so the crown cutting. Okay. So all these tasks which I spoke about, 6 tasks basically, which is the restorative cluster and the preparatory cluster, they both together form your technical day. That is one day in your ADC part 2 exam. Okay. So your technical day, again, it's going to be for 6 hours and you'll have 6 tasks which you have to end up doing. Now, technical day, obviously, how we are going to prepare for our technical day, you need at least minimum of 3 to 6 months of preparation. All right. You need to start planning soon. You need to start planning early, because most of, even for like if you want to join us, even our courses are booked out till the end of this year, right? So if you're planning to give your exam in January, and if you do not get a seat in the course to prepare for your exam till December, then you're going to be stuck, right? And you'll have exam in January. Okay. So you need to start preparing and planning quickly so that you have enough time. Like you need minimum of 3 to 6 months for the preparation. Okay. Because technical day or technical task, it all comes with a lot of preparation, because the amount of detailed work they need on your technical day is like in millimeters, right? So if your margin of a porcelain fused to metal crown or a PFM, if it is not 1.2, but if it is 1.5, they will put you into a fail category, right? So just that difference between 1.2 millimeters to 1.5 millimeters, basically we are talking about the difference of 0.3 millimeters, which is hardly anything, right? So they go into a lot of detail or a lot of technicality into all of these. So you need that much time for preparation, and that's why you need to start acting fast. I want you all to start with your home setup soon. I want you all to decide which course you're going to be doing and start preparing, okay? Because you need that much time. All right. I'll go a little bit more detail about technical, but let's talk about the second day of the ADC Part 2 examination. So first day, we already spoke about technical. The second day has 2 parts. One part is called the skilled OSCE. Okay, so skilled OSCE meaning that you need to perform a particular task All right. So they'll give you a particular task, and those are going to be only 4 tasks. Like how in technicals, I told you that you'll have 6 tasks. In your skilled OSCE day, which is like your second day of the exam, the skilled OSCE, you'll have 4 tasks, right? Now, out of these 4 tasks, you might have one task like place a rubber dam on the tooth, okay? So they will just assess you on how you're going to place a rubber dam and do you know how to isolate a tooth or not. Or they might say extract tooth number 16 on the mannequin. So they will just see how you're extracting the tooth, okay? Or they might say something like put pit and fissure sealant on one of the molars or two of the molars. So they're going to watch you how you're going to do the pit and fissure sealant, okay? So basically we have around 10 skilled OSCE tasks, out of which they only give you 4 of them, and they keep repeating these, okay? And they have kept repeating these from the last few years, like 2 to 3 years. However, there's no guarantee. ADC can always change things, all right? And that's what makes you a better dentist, because you're prepared for any scenario, whatever ADC gives you, right? And that's what we also teach in the academy. We don't just stick to what comes in ADC, but we want you all to become a good dentist overall, right? So in skilled OSCE, again, like I said, you'll have 4 tasks. So out of those 10 or 12 tasks which keep coming all the time, they'll give you only 4 of those tasks, all right? And then you have communication OSCE, which is the second part, right? I told you we divide that second day into 2. One was your skilled OSCE, and then you have a communication OSCE. Communication OSCE, basically you'll have 6 stations, all right? That means you'll have to perform 6 of them in your communication OSCEs. So basically your ADC examination center will have like 10 rooms. So out of those 10 rooms, you will be going into each room one after the other. So 4 of the rooms will have your skilled OSCE, and the other 6 rooms will have your communication OSCEs. In communication OSCEs, basically you are just communicating with the examiner. The examiner will act as a patient, and there'll be another examiner who will be watching, or there might just be one examiner, okay? So basically you are the dentist. The examiner who you're talking to acts like he's the patient, but he's also judging you. But sometimes there might be another examiner sitting next to you, and they might also be judging, okay? So that's how your second day would work. So 4 skilled OSCE tasks and 6 communication scenarios, all right? Now, how you should basically make a structure for your study, like I told you, right? It's very important, very, very important. Like some of you all must be part 1 candidates from Dr. Adams Academy or Dr. Adams course. Some of them might not be. Some of them you all must have prepared for your part 1 exam on your own. But guys, part 2 examination, I wouldn't recommend that at all. You cannot prepare on your own, because this examination needs a little bit more than what general dentistry is offering, right? Because you want it specific to what ADC is looking out for. If you manage to get that much, you will clear the exam, definitely. Okay, because it's not about what you're doing general dentistry in your clinics. It's a bit different. Obviously, this is a general dentistry exam, but it's very detailed. Like I told you, like 0.2, 0.3 millimeter here and there, they can fail you, right? Or while communicating, if you use like a dental term, right, which your patient wouldn't understand, and they can fail you, okay? Or your body language, if you appear to be extremely nervous, you do not have a great eye contact with the patient, or you keep moving your hands, or you keep touching your hair, that just shows that you're not confident, right? So all of these things are assessed in the exam, and that's why it's not an exam where you can just, fling it, just come, sit for the exam, and then, yes, it won't work that way. Okay. So I would highly recommend, and I told you all yesterday as well, firstly, start with your home setup, get that organized, decide which course you're planning to do. Either you're planning to do a course which is on site, which means that you're physically going to the academy and doing it. Okay, or you're planning to do a course which is online, where you can attend some courses online. My recommendation is always to do an on-site course, like a comprehensive on-site course, Obviously, you don't need very long courses. You don't need to be like for 3 months in a course, right? A course which will teach you everything in a shorter duration as well, because the longer you are there, the more lazier you can become sometimes. Okay. So you want to learn all the information, and then you need to go back into your space and try to focus on your skills as well, and how you're going to maneuver around with your techniques. Okay. And then obviously you keep going back whichever academy you're going for, like sessions, like work under supervisions, and then getting your work assessed and all of these things as well. Okay. So stepwise, getting your home setup done side by side, pick up a comprehensive course on site or online, okay, where you'll get all the information about what all tasks are there, what all basically you need in technical, like amalgam, right? You might read like the amalgam criterias. You might watch some videos of amalgam on the internet, but that's not going to be helpful, okay? Because you need somebody who's going to teach you exactly what is needed for ADC. And my point, which I told you before as well, not only what is needed for ADC, because when y'all are performing in the academy or when y'all are performing at home, y'all are not that stressed. But when y'all go for the exam, that's when all the fun begins, right? Because you all have not worked into that stressful environment, and then you all cannot perform. So it's not only about learning what ADC needs, but it's about learning to work in high pressure environment. Okay. And learning to work in a way that when things go wrong, how are you going to fix it? Okay. And that's basically what we focus on, and that's what we are very proud in our academy to say, that we always focus on those things and not just telling you how to do the job. Okay. So getting the comprehensive course either online or on site. Okay. Then going back home and practicing for at least a good 3 months, like I told you. Okay. If you have more time, great, 3 to 6 months, but a minimum of 3 months. Keep practicing. All right. And then obviously always try to do some mock exams. You can do mock exams at your home as well. Every day you should work in an environment like a mock exam, where you will time yourself, that you sit on your table at 9 and you get up only at 12 in 3 hours, exactly how it works in the exam. And then you will take a 1 hour lunch break, because that would happen in the exam, and then you'll still continue for another 3 hours. Okay. So that's how you're going to work when you're working for the next 4 months. All right. You have to work for, I would say, 6 to 9 hours a day, like how you all have dedicatedly given that time for part one. You have to give the same time for part two, and you have to work 6 to 7 days a week. There is no break. All right. Remember your goal. Imagine if you had to probably lose some weight, right? And you had like 3 months. You always have a goal in your mind that you have to do it. There's no cheat day. There's no skipping anything, right? It's exactly going to be like that. You have to dedicate yourself. All right. I'm not saying that if you're working completely quit it. I understand there is obviously financial responsibilities. You're managing your house, you're managing your kids and family, but try your best if you can cut down on doing your work apart from ADC for that first at least 3 to 4 months. All right. Then in your OSCE preparation, obviously that is more for your clinical and your communication OSCEs and stuff. If you're dividing the day, you do like 6 hours, obviously for technical, and another 3 to 4 hours of study for your communication. Okay. I hope everyone's following and there is no questions. Dr. Adam, are you there? Anyone from the academy admins, if you all can check. We don't have any questions on Facebook. All right, I'm gonna continue. Dr. Jasmine, do you want to say something? I've
Hi,
unmuted
Dr.
you.
Alicia.
Hello, Dr. Jasmine, how are you?
I'm good. How are you?
Thank you.
Do you want me to check on the Facebook Live?
Yeah, you can check if there's any questions. If anyone
Yes,
has.
sure.
Yes, Dr. Jasmine?
No questions for now.
Okay, that's good. Thank you. Alrighty. So when is the best time to start? Obviously, like I told you all that longer the time you have, it's great. Okay. But you definitely want at least 3 to 6 months to practice for your exam. Okay. Is online course sufficient? Obviously, you all must be having these doubts as well, because these are very common doubts, especially when you'll start off that, I have a commitment, I'm working, like I cannot miss work, and then I can get time only for a few hours. Or maybe I cannot travel, I'm overseas somewhere and I cannot travel for these particular courses. So, yes, an online course would also help, at least for you to start off your journey. Okay. So, if you're thinking about any online course, you can think about starting off your journey at least with that rather than doing nothing. Okay. And if you all are overseas, and if you're like planning for giving your exam anytime soon, maybe in the next 4 to 6 months or something like that, I would always recommend it that you plan it in a way that you first take a comprehensive course, if that's a possibility. If you can do it online, that's okay. But if you can physically come to a course, that is the best thing or a best decision you will make. So you start the course earlier, prepare for like 2 to 3 weeks in the course, and then you go back to your home country, wherever you are, prepare for a good 3 to 4 months, and then you come and sit for the exam. Okay. I wouldn't normally recommend that you'll take a course just before your exam, that, oh, I'm going to Australia, so, my exam is there in a month. I'll just go a month prior, do the course, and then sit for the exam. All right. I don't recommend that as much, but obviously situation is different for everyone, right? Now, if you don't have a choice and if you can't keep traveling back and forth, then at least that's also a better option. Okay. But try your best if you can, starting the course a bit more earlier, plan your travel, that you'll get that enough time in your own environment to work. Because if you'll leave all of this till the end minute, and then that stress starts building up, right? And when you all are stressed, that's when things go wrong. Okay. I'm not going to go into this for now. Let me just go back. We will go through all of this more detail in our course orientation. This video presentation was not for the course orientation, but let me go back to technical. Okay, what I would recommend right now is all of you all can, I'll just show you all a little bit about the ADC Practical Examination Handbook, which is readily available on the internet. So if you all have the ADC Practical Examination Handbook, or if you all can Google it right now, because I need all of you all to know what is this ADC Practical Examination Handbook, and how how it is going to be so important for you in this journey. Okay, so that is the first thing you should actually be seeing. So let me also share it. So if you just go and Google it, this is basically your Australian Dental Council Practical Examination Handbook. Okay. And that will have a lot of information, like all of this, like your eligibility, your application process, examination, accommodations, where you can stay around and all of that, whatever refunds and stuff you don't want to. So if you look at this venue here, that's basically your ADC Part 2 examination menu. Okay. And that's located in Melbourne. It's in it's on La Trobe Street, and that's like a 5 minutes tram ride from us as well, from the academy. So it's very close. It's in the city. Okay. And this venue you have to go on both your days, for your technical day and also for your communication or your skill or ski day as well. All right. Sorry, just went down.
Hello, Dr. Alicia.
Hello.
I'm sorry for interrupting. We have 2 questions on Facebook.
Yep. Can you tell me what that question is? Can you read it out?
Yes. Dr. Natalie says, how long is the comprehensive on-site course?
Our comprehensive on-site course is for 2 weeks, and then we have OSCEs as well, another day for our OSCEs. So you can get more information from the admins regarding that a bit later, Natalie. You can directly contact them and they can send you more information. And obviously, when we do more of our orientation session for the course, which will be next week, I believe it's on Thursday, we'll give you more information about that as well. Okay, and that'll get things more clearer for you all. Next question, please, Dr. Jasmine.
Yes. Dr. Fatima says, if suppose we completed with composite restoration and starting with amalgam, can we
Yeah.
go again with composite restoration just to smooth or finish it?
Yes, yes, definitely, definitely. So if you're, so like I told you, there is no time restriction in a way that if you do composite for 1 hour and then you leave it midway, you're like fed up of composite and it's not working. So you end up going to amalgam. Okay. And then after you finish amalgam and after you finish all your tasks, if you want to come back to that composite, if you have enough time, you can always swap between the two. So there is no harm in swapping. Okay. So it's not that you do one task and then they come and check it right away. They don't do that. And it's not that if you do one task, you have to submit it immediately. No. So you do the task and at the end of the day, when your time finishes, they will come and collect the jaw so that they can check all the teeth. And they do not assess it on the same day as well. They will assess it a bit later. So they're not assessing it in front of you. Okay. I hope that's clear, Dr. Fatima. All right, so this is the ADC exam menu. Again, the premises, which you can see here. And this is basically the equipment, exactly like I showed you yesterday as well. Okay, and this is how your technical skills day is, right? So if you see the timings, that's what's given over here. The technical skills day, that the registration process is from 8:15 to 8:45. And then basically your exams starts at 9:15, ends at 12:30, and then you have a 45 minutes lunch break, and then you have another 3 hours, right? So 3 hours, then 45 minutes lunch, and then you have 3 hours again. Okay, so that's basically your timetable which will be there. So you're going to start the exam, you're going to be there at 8:15 in the morning, and your exam will start at 9:15. Okay, in the clinical skills day, like I told you, the second day, they will basically divide you all into two groups, group 1 and group 2. And you will either have a morning session or you'll have an afternoon session. So they will let you know from before that which session you are allocated. So either you'll have your exam in the morning or you'll have your exam in the afternoon. Okay. What all things you can bring for the examination? You can only bring your ID, your government issued identification. So basically either your passport or your driver's license and stuff. And the only thing you can carry is your safety eyewear because it clearly mentions that it will not be provided. Okay. Rest, all of the things ADC will provide you. So if you have this doubt in your mind that, oh, do I have to carry all my equipments, materials, all of these things to the exam? No, you don't have to carry anything. You only have to carry your protective eyewear. You can also carry your loops, but you need some kind of a protective eyewear. And obviously, you need to carry your identification document. So that's the only thing you can bring. Okay. Then going back down. This is a very good thing. And most of the students have this doubt even after, like, when they start the course or when they are midway in their preparation. What about medications and other related items, right? So obviously, if you have any medical conditions and you feel that you might not be able to do the technical for that many hours, or you might need to have some medications in between, or you might need some break in between, it's always a good idea that once you get your examination seat, that you contact ADC with a proper medical certificate and your doctor's instructions. Okay. And then you can just pass it to them and they will make some arrangements for you. Okay, so that they allow you either to get those medications in the room, or they'll give you some time where you can actually go and take your medications and all of these things. So you don't have to be scared if you have certain conditions like that. It's always manageable. Okay, now materials and instruments which ADC will give you, all of them are here, like your restorative kit, your diagnostic kit, all the burrs and polishers, whatever ADC gives you in the exam. And this is what I exactly shared with you all yesterday as well in the home setup session, that you have everything of this on the ADC practical examination handbook. So you'll exactly know what all things you'll need to buy as well. So all these burrs they will provide you, which you will basically use for your technical day. Okay. What type of models are used? They've also clearly mentioned here. It's a Columbia Dentoform model, which I told you all yesterday. And then coming down, which is very, very important, is this. Let me scroll down. Is your technical criteria, okay? If it's not over here, I'll get it to you. So if you look at, give me 1 second, I'll just pause this for a bit. Is everyone following? And do we have any other questions? Okay, I'm gonna share this again. Yep. So over here, they tell you about the practical examination content of what all things are there. So like I already discussed with you that you'll have OSCE and technical, right? So in this OSCE and technical also, they divide it into basically three categories. One cluster is your clinical information gathering. The other is your diagnosis and management planning. And the other is your clinical treatment and evaluation. So basically, the things which I told you that, your day 2 consists of 10 stations. So 2, 4, 6, and then another 4, which is 10. So your clinical skills day will have 10 of them. And then your technical day has 6 of them, right? Which I already explained to you. Now, out of these, your OSCE will be either a part of clinical information gathering, it'll either be a part of diagnosis and management, or it'll be a part of your clinical treatment evaluation. Okay. While your technical task comes as a part of your clinical treatment and evaluation. Okay. So I really want you all to read this handbook very well, because all the information you need basically for ADC is given right here. Okay. And this you should know by heart till now. Like if you've cleared your part 1 and if you're already in your journey towards part 2, this has to be at the back of your mind. Okay. And then if I scroll down the practical examination format, it also tells us what basically the format is. So in every exam, there'll be 24 candidates. Okay. And they'll divide you all into 2 groups. So each group has 12. So if 12 of them are giving their technical exam on day 1, the other 12 will be giving their skilled OSCE, right? And then they swap on the next day. All right. Now somebody has questions. Let me just unmute our admins. Yes, can you all please tell me what questions it is? Dr. Jasmine, are you here? Or are you still on mute? Yes, Dr. Jasmine, can you hear me?
The questions we have.
Yep.
How can we prepare for day 2 at home. Can you hear me, doctor?
Yes, I can. So how can you prepare for day 2 at home? So day 2 means it's your
Yes.
communication and your skilled OSCE day. All right. That's what we're talking about. Now, it doesn't mean day 2 is day 2 for everyone. You might have clinical and communication on day 1. Okay. So let's not call it as day 1, day 2. Let's call it as technical day. And then we call it as a communication or the skilled OSCE day. All right. So how do you prepare for communication and skilled OSCE? Obviously, if you all are taking any of our courses, we have a communication course which runs every week, and it's like 2 times and 3 times as well sometimes in a week. So basically you're preparing that way. Okay. And the other way you're doing preparation for your skilled OSCE task is like you're basically doing all that. Like you'll place a rubber dam on your mannequin. Okay. And you'll pretend as if you're extracting the tooth. It's the same thing. Like how it will be in your technical is the same way you're going to do the preparation at home as well. All right. All right.
All
Dr.
right.
Jasmine, any
And the
more?
other question?
Yep.
Yes. Dr. Muhammad says, what are the technical tasks? Would you please let him know?
Yeah.
Ask
So
them
yeah, we already went through
like
all the
it's
technical
the
tasks.
technical tasks.
Okay. So Dr. Mohammed, we already went through the technical tasks. I'm not sure if you've joined a bit late, but there are 6 technical tasks, and I'm coming down here. So these 6 technical tasks are over here, right? So one is preparation of a cavity prep tooth. Then we have composite restoration. We have amalgam restoration. We have provisional crown, and we have crown prep, that is preparation and temporization. And then we have root canal, that is access opening. And we already said that we've divided these 3 or these 6 into 2 categories. One is a preparation cluster,
Mhm.
and the other one is a restorative cluster. Okay.
Okay. And Dr. Naveen asks, part 1 is also available offline.
Part 1 is no. Part 1 is not offline. Part 1 is online.
Okay. That's it for now. No
Okay.
more
All right.
questions.
All right. Thank you.
Yeah.
All right. And clinical skills day, we also spoke a little bit about it, but we'll speak more in detail when we go and talk about clinical skills day, which mostly Dr. Adam will do. Okay. And yes, so coming to the main thing which I told you, very, very important is this. So if you scroll down all the way, you'll see something like this, okay, which says observation, very good, satisfactory, borderline, and unsatisfactory. So you know how you have your therapeutic guidelines in part 1 as your main book. This is going to be your main book for your technical. Okay. So you have to know everything which is written on this book, from the front page to the last page, from the first word to the last word. Okay. Especially these criterias. All right. Because these criterias are very, very important. All right. Especially if you're while you're preparing for your technical. All right. So all of these things, like if you see, this one criteria is for composite preparation or for your cavity prep. Okay. Then we'll have another criteria which is for your complex amalgam restoration. Okay. So this tells you where you will be graded. Like if you have a amalgam restoration with like maybe like this, like some areas of roughness, they will put you in a satisfactory. If your amalgam has excessive roughness which cannot be polished, they'll put you in unsatisfactory. Okay. Or if you see this, look at this borderline criteria, that if you have a deficiency or a void in your amalgam restoration with a margin of less than 0.5 millimeters, then you can be in a borderline. But if it is more than 0.5 millimeters, you can be in unsatisfactory. Okay. So these criteria are very important. I know it's very early stage right now for y'all because you'll have just cleared, but you'll have to start learning all these criteria because this will make your work more and more better. So my advice, start with reading all of this. All right. And obviously, when you'll come to the academy, we go in more depth and detail about all these criterias. I love the criterias. I never do a demo without going through the criterias. It's very, very important that you all know the criterias by heart. Okay. And this is going to be your TG for the next 3 to 6 months. All right. Okay, just give me a second. And like I told you, please start planning for your journey soon. All right. Because it's very hard. Like, even if you all are planning to join our academy, it's very hard to get bookings. I know some students, unfortunately, we cannot end up helping them. They miss out because there is no slot available. Okay. So please plan ahead. If you all are trying to book your exam, then make sure that you all don't book it like immediately in 2 months' time, because you all need to first see availability and all of these things as well, for how much you're preparing. Because we are, like, even right now, when I spoke to the admin yesterday, they said, no, doctor, we are fully booked for this year and we don't have any seats left. So the only next seat which they can offer to our candidates, even like our part one candidates who are like really Dr. Bido's part one candidates, they should be getting more of a priority because they have been with our academy for that long. But unfortunately, we will have to like offer, later dates as well. So please make sure that you all start planning ahead. Okay. And very important that you go through all of these criterias, which is going to become your basis of your technical. Okay. And the more you all read it, the more you all will be able to assess your own work. And once you all can assess your own work, then you all can start grading yourself as well. Okay. And grading yourself, all of it is written over here, like what very good means. What does satisfactory mean? What does borderline mean? How many satisfactories will be allowed for you, or how many unsatisfactories are allowed? Because obviously these criteria, if you see in one, like this is one complex amalgam restoration, it has so many, right? It will check whether your amalgam has a good finish. They will check whether your amalgam has any porosities. They will check whether your amalgam has any amalgam debris, or how is the restoration integrity. Are there any overhangs in your amalgam? Have you damaged the adjacent tooth? Have you damaged the gingiva? All of these things. All right. Just give me 1 second. Alrighty. So, like I told you, I wanted to keep this session short and not go into too much, bombard you with a lot of information, because we're going to do more of sessions. I'm giving you a kind of a homework that if you all are really interested, please start your journey now. That's one. Because if you want to be very serious about this exam, I don't want you all to take it as a backstage. Okay, I'll do it in a few months, whatever. No, you'll have to start planning for it now. Start getting all your stuff ready. Start getting your home setup organized. I already did a very detailed session yesterday, so you all should have at least a basic understanding about your home setup, right? Get that organized. Start deciding which course you're going to be doing. Like I told you, plan ahead. Okay. Speak to the academy if you want any sessions. At least get onto the wait list. Even if you don't end up getting a booking this year, at least get onto the wait list. Anyone cancels, they can always accommodate you, or we can always have more. The academy can get some more mannequins and seats and try to accommodate you. Okay, so try to plan ahead. That's one. And the great homework which I'm giving you is, I want you to go to this ADC practical examination handbook, in and out. Okay, once you go through this in and out, you'll have so much information about what your ADC part 2 journey will consist of, so that you can start following our sessions clearly. Because I don't want you all to be confused in the future sessions. Like if I'm doing a session next week and I'm talking something about how our course runs, or what is amalgam, or what is this, you all should be clear about this. So please go through all of these things, which will make your mind very clear about the practical examination, and then I can give you more and more detail. Okay, so it's more like a homework for y'all. So please try to be on top of this. All right. And I'm going to see you all soon in the next week. And if you all have any questions, please contact the academy. They're always there to help you. All right. And I want to see you all physically one day, one-on-one in the academy or even in our online classes so that I can help you better. Okay. So I really look forward to seeing all of y'all, and I will see you all in the sessions again. All right. Thank you so much. Have a lovely night, everyone, and I will see you all soon. Thank you.